So the main symptoms of peripheral arterial disease are intermittent claudication, wrist pain, and tissue loss. There are less common symptoms that the patient might complain of, which are coldness in the peripheries, loss of hair from hands, feet, or lower legs, distal legs and distal forearms, nails, they can get brittle, loss of luster, easily broken. The patient might feel some numbness. This is usually related to a nerve problem, but it could be related to peripheral arterial disease. The patient might notice that there is a change in the color in the form of pallor or bluish discoloration in his fingers or toes. But we'll discuss now the main symptoms that the patient might have. The first one is intermittent claudication. Intermittent claudication is a pain, and to analyze pain, we have to ask specific questions: onset, course, duration, character, site of the pain, what increases and what decreases if the pain is referred to somewhere else, and severity of the pain. And before we discuss how we will analyze the intermittent claudication, we need to understand the pathology of intermittent claudication. If someone is sitting and he's doing no exercise, the skeletal muscle needs X amount of arterial blood to maintain aerobic respiration, to maintain the cell's breathing. And the artery will deliver this X amount of blood to the muscle. If someone starts to do an exercise and this exercise needs double X of blood supply to maintain the aerobic respiration in the muscle, either this artery is able to deliver this amount of blood and oxygen or it's not. So if it is able to deliver the amount of oxygen needed to maintain aerobic respiration in the Krebs cycle in the skeletal muscles, the patient will maintain doing the exercise without problem. Once actually the patient is not capable to deliver the amount of oxygen needed for this exercise, the muscles will start anaerobic respiration because of lack of oxygen. The anaerobic respiration will cause production of energy and metabolites and lactic acid in the muscle. Accumulation of lactic acid in the muscles will give the patient the feeling of the cramp. And this is exactly what happens in patients with peripheral arterial disease. So when we want to analyze the intermittent claudication to be sure that this is a genuine symptom, we have to ask the patient these questions, but we have to stress on 4 questions. The first thing, the site of the pain. As we have mentioned here, the claudication occurs because of accumulation of lactic acid in the muscles. So the site should be group of muscles. And the main group of muscles that would be affected in the lower limb is the buttocks, the thigh, and the calf. The calf is the most common affected site by intermittent claudication because the superficial femoral artery is the most common artery affected by peripheral arterial disease. The second important thing is the character of the pain. We have mentioned that accumulation of lactic acid will cause claudication and crampy pain. So the pain should be crampy or like tightness. It will never be stabbing pain or numbness or pins and needles, because there are different pathologies that can cause this kind of pain in the muscle. The third and fourth question, which is very logic, that actually what increases, what decreases. What increases will be exercise. So once the patient will start to do any sort of exercise that he is using his lower limbs, like jogging, walking, running, cycling, swimming, the patient might get claudication. And once the patient will have rest or stop exercising, then the patient will have relief of symptoms after a while, because the oxygen demand will decrease in the muscle. The other questions are important as well. Usually the onset is gradual, and the course, as I mentioned, will be either stationary, progressive over a period of time, or regressive if the patient starts to take medication and modify his lifestyle. There are 2 important things as well that we have to ask about intermittent claudication. The first thing is the distance. So knowing the distance is very important as a prognostic factor to know if the patient is getting better in the future or getting worse or the same. And the most important thing to be sure that this intermittent claudication is a real genuine symptom, that it should be reproducible. So if the patient can walk one day 2 kilometers and the other day he can walk only 50 meters, this actually excludes that this is a claudication, because claudication is reproducible. The patient should have a pain every time he walks this distance. This distance might get shorter or longer depending on the patient's lifestyle, but it cannot be fluctuant from a day to another. In the next videos, we'll talk about other symptoms of peripheral vascular disease. Thank you for joining us, and don't forget to leave your questions and comments below the video.